Hello, my name is Nathan Latour, and this is my final presentation for Psych 3115, Intro to Psychopathology. I'm doing my presentation and paper on attention deficit hyperactivity disorder, so ADHD, which is a neurodevelopmental disorder that actually affects about 9.4% of adolescents ages 2 to 17, that according to very well mind. Um, so the three main symptoms of ADHD are inattention, hyperactivity, and impulsiveness. Um, ADHD also occurs more often in males than females, and the symptoms are shown differently between the genders, whereas the females are more likely to show like quiet, inattentive, like not focusing, and then boys may be showing more hyperactive symptoms. Um, According to the DSM, um, people must show six or more symptoms from each of the categories: inattention and hyperactivity and impulsivity. Impulsivity. So for the inattention, they have to be failing to give close attention to details or make careless mistakes in schoolwork, at work, or with other activities. They often have trouble focusing or holding their attention on tasks, does not seem to listen to when spoken to directly, and does not follow through on instructions, fails to finish schoolwork, gets sidetracked, has trouble getting organized, is reluctant and doesn't like to do tasks that require mental effort, such as schoolwork or homework. They often loses things necessary for tasks, so like losing a pencil, losing your glasses. Then for hyperactivity and impulsivity, six or more symptoms must be shown for a diagnosis. So squidgeting or squirming, fidgeting in a seat, taps hands or feet, leaving your seat when you were supposed to be remaining seated, general hyperactivity, so running around, climbing in situations where it's not appropriate, talking excessively, blurts out an answer, blurting out things, having trouble waiting their turn. Also, for a DSM diagnosis, there must be it must be present in two or more situations, such as like in the home and also at school. Can't be just having problems at school. Has to be two. The causes of ADHD, they're not fully understood yet, but the research has suggested that genetics, brain development, and environmental factors play a big role. It's also genetic, heritable, so meaning that it runs in families. According to causes of ADHD, children with a parent or a sibling have a 1 in 4 chance of developing ADHD themselves. ADHD affects the frontal lobe of the brain, which is responsible for executive functions such as attention and impulse control, and the frontal lobe may be smaller in children with ADHD. Another cause of ADHD is emotional or hormonal deregulation. So the dopamine may be dysregulated by children with by in children that have ADHD. Also, exposure to toxins such as lead during early childhood has been proven to increase the risk of developing ADHD. Um, Another one is maternal smoking, premature birth may also risk the developing of ADHD, along with traumatic head injuries. Um, According to the diagnosis and treatment options, um, family therapy and parent training is big for that. There's also a lot of, if it's appropriate, medications that can be prescribed for ADHD. Um, but behavior therapy usually comes first, especially in children that are younger, under 4 years old. It's usually recommended. Parent training and behavior therapies for children under the age of 6 years old. Excuse me. According to the CDC, ADHD and treatment, and most of the medications that are prescribed for ADHD are stimulants, and stimulants increase the activity of dopamine in the brain, which increases alertness, attention, and energy. However, these stimulants have a lot of side effects on children, such as anger, paranoia, heart problems. Children also, once the medication starts to wear off throughout the day, they show these symptoms more, so they might be more aggressive when they're coming down off the medication. And these medications are really hard on children's bodies, which is why therapy and treatment before medication is often tried. I learned a lot about ADHD during this, and this kind of helped me because I'm diagnosed with ADHD, and just learning about how I may have gotten it, and other treatments that can be available, such as mindfulness, which is a way that I deal with my ADHD. So if I'm having problems concentrating, I just think, what can I do in the current moment that will help me with help me focus more and kind of keeps me grounded. And yeah, thank you so much.